We should always encourage people to come in to see a healthcare provider if they notice something that looks different.
Now I want to know, what do men panic about when they look at their penises that's almost always completely normal?
I've never seen such high anxiety when men come in and they're worried they have a sexually transmitted illness. They notice a bump on their penis. When a guy notices like a lump or bump on his penis, especially if he's had a recent like high risk interaction with a partner or unprotected sex, he is very nervous that he has an STI. Now, I think that's totally legit reason to see a healthcare provider, because
Sure.
sometimes it is an STI, right? It's not always an ingrown hair. Definitely something that you want to get checked out. We should always encourage people to come in to see a healthcare provider if they notice something that looks different.
Right. Oh, for sure. I would say always play it safe. So, besides an ingrown hair, like what else could it be? Skin irritation, skin tag, are those common things you see?
Yeah, I mean, it could be a skin tag. It could be some guys when they're circumcised, they get like these skin bridges of the tissue that just kind of heals in a different way. It could be irritation from different soaps that people are using. It could be a dermatitis. But most of the time, I would say it's like an ingrown hair because they're kind of shaving that part of their penis. Yeah.
Yeah, that totally makes sense. All right, I want to talk to you about testosterone. What does healthy testosterone support when it comes to sexual confidence, energy, and pleasure?
So, testosterone is really important for foundational well being, including sexual health. And we oftentimes think about testosterone. I mean, it is called a sex hormone. So, oftentimes it gets lumped into, if you don't have erectile dysfunction or you don't have low libido, then your testosterone level, must be normal. And that's not true, right? Someone could have a completely normal sex drive and completely normal erections and still have low testosterone. People can also have normal testosterone and still have erectile dysfunction, right? So not everyone who has ED has low T. However, I will say this, Michelle, if guys are coming in and they're not having as robust erections as they used to have, they should get their testosterone level checked. In fact, it's in our American Urological Association guidelines, because if we optimize someone's hormones, we will help them become better responders to therapies that specifically treat ED, medications like tadalafil and sildenafil, which are the generics for Viagra and Cialis. So you don't want to skip foundational hormone support.
Yeah.
Do I necessarily give men who have ED testosterone therapy to help with their ED? No, it wouldn't be a primary treatment, but it can help them better respond to ED treatments.
Yeah, absolutely.